Oh, yeah, you got the tube. Congratulations. But you gave a kid with neuromuscular problems succinylcholine. Did you just want to see what hyperkalemia looked like? Want to dance with that devil for a little while? Well, guess what? We're going to be dancing for the next 90 minutes. What the? Hey, quick public service announcement. For those who need to hear it, do not give succinylcholine to any patient, whether pediatric or adult, that has a neuromuscular problem, because it's going to cause massive hyperkalemia, and you're going to put him in cardiac arrest quick, fast, and in a hurry. Let me show you how it works. Okay, the contraindications for succinylcholine include hyperkalemia. They also include crush injury right away and burn injuries 24 hours status post the burn. Both of those are due because that's when you start having massive potassium shifts and leak, and potassium is causing hyperkalemia. Potassium is getting outside the cell. Any hypersensitivity, of course, and in patients with neuromuscular conditions, neuromuscular problems, multiple sclerosis, myasthenia gravis, anything where the muscle and the nerve don't talk very well. All right, let's go see a little bit deeper on why that's important, and beyond just the neuromuscular problems and all the different, you don't have to memorize all of these, but I do want to show you something. These also include wheelchair-bound patients, bed-bound patients that have been bed-bound longer than a day, your patients who already have contractures, your patients who get around with crutches or a brace, your patients that are in a cast for longer than a day. Any of these, basically what the body does is it ramps up the production of the receptor that accepts acetylcholine. What does acetylcholine sound like? Succinylcholine. They're very, very similar in shape. So I'm about to show you how that happens. But ultimately, if you're not moving your muscles, your body goes, hey, wonder why this muscle's not moving. You know what? Maybe we'll just build a whole lot more receptors. Maybe there's just not enough receptors to catch the acetylcholine. Now, the normal thing is, well, let's get to that next. Let me show you this. In a normal motor end plate, you have the nerve terminal, and then acetylcholine crosses that motor end plate and hits a acetylcholine receptor. Acetylcholine gets in that acetylcholine receptor, triggers the muscle to fire, and a little byproduct of that is a little bit of potassium you see. So this is normal. Normally just a tiny bit of acetylcholine is released, and there's just enough receptors to get the job done, make the motor work. Now, anybody that doesn't move a muscle for any reason, whether it's like a neuromuscular disease, they're in a wheelchair, they're on crutches, they're bedbound, they have a cast, any of that stuff, this is what it looks like. Go to the next one. Your body builds a whole lot more receptors, thinking like maybe that's what we need to do to catch more acetylcholine to trigger the muscle to fire. So you give a kid or an adult, in this case a kid, succinylcholine, again, succinylcholine, acetylcholine go into the same receptor, and it almost, because when you give succinylcholine, you give a bunch of it, right? When we give our dose, and it floods every one of these extra receptors. The next thing you know, we have lots of potassium released, and your patient could go into cardiac arrest. So you want to be looking every time you give succinylcholine for evidence of this. Now, there's one other thing that'll happen in succinylcholine. It's called malignant hyperthermia, and I'm going to talk about that in another video. So while I think there is a time and a place for succinylcholine, there's some dangers out there, and neuromuscular problem or undiagnosed neuromuscular problems in kids, that's a big one. We'll do some follow-up videos here with this, but let me know what you think. Stay safe out there. Avoid succinylcholine for neuromuscular problems, burn injuries after 24 hours, crush injuries right away, anything that causes hyperkalemia. Stay safe out there. Stay salty, guys.